All right, today we're going to do something a little different. We're going to take a big step back and zoom out from the usual world of individual checkups to see a much bigger picture of health. We're going to explore a field of medicine that doesn't just treat one person at a time, but entire populations. Let's dive right in.
So, when I say the word medicine, what's the first thing that pops into your head? I'm willing to bet for most of you, it's that classic scene, right? One doctor, one patient, maybe in a small office. It's personal, it's direct, and it's all about fixing what's wrong with that single person. But what if we just flip that script completely? I mean, what if instead of just treating one person's cold, we could stop thousands of people from ever getting sick in the first place? That's when we start to zoom out, from looking at a single tree, to seeing the entire forest.
And yeah, this whole big picture approach, it actually has a name. It's called community medicine. And honestly, it requires a pretty big shift in how we think about health.
So, let's break it down. What is it? Well, in the simplest terms, community medicine is the branch of medicine that deals with whole populations. And that's the key right there. The patient isn't a single person, it's the entire community.
And this is where you can really see the difference. The kind of clinical medicine we're all used to, it's usually reactive. You get sick, you go to the doctor, they treat you. Simple. But community medicine, it's proactive. It looks at everybody, the healthy people and the sick people, to figure out how to improve the health of the whole group.
So really, it all boils down to asking a totally different kind of question. It's not, hey, how do I cure this person's flu? Instead, it's, okay, how do we stop a flu outbreak from hitting this entire town in the first place? See the difference? It's all about being proactive, not just reactive.
So, what does that actually look like on the ground? Well, you can kind of think of these professionals as health detectives for a whole community. Their job follows this really cool cycle. First, they have to investigate and measure what the community actually needs. Then, they plan out services to meet those needs. And of course, they have to deliver those services effectively. And all along the way, they're doing research to find even better ways to keep everyone healthy.
Now, this whole approach is super comprehensive. You can actually break it down into 4 main stages, or let's call them the 4 pillars of health.
And this cycle of care is it's so thorough. It really covers all the bases. It kicks off with health promotion. Think about things like public campaigns for healthy eating. Then you've got disease prevention, like, say, big vaccination drives. Now, if people do get sick, the focus shifts to health restoration. That's the treatment part. And finally, you have rehabilitation, which helps people recover and get back to their lives. It's really the whole journey of care, from start to finish.
Okay, so we've been using this word community a lot, but what does that actually mean? Who are we talking about here? Let's get specific.
Right. The really important thing to get here is that we're talking about a defined group of people. It's not just some vague idea of people who live around here. In community medicine, the group is specific, it's measurable.
And how do they define it? A lot of the time, it's based on geography. So it could be a group of villages that all use the same water source, or maybe a specific city block, or even a whole urban area. The scale might change, but the focus on that defined group, that stays the same.
All right, so we get what community medicine is, and we know who it's for. But where does all this work actually happen? Well, that brings us to what's called the delivery base.
Yeah, you can't just do this kind of large-scale healthcare on the fly. It needs a really solid foundation. Community medicine is super organized, and it operates from these established institutional bases. That's what gives it the structure and the resources to actually serve an entire population.
And you've definitely seen these places around. They're often academic departments in medical colleges, where they're training the next generation of public health experts. Or they're the local health centers and public health institutions that plan those big citywide health campaigns.
If there's one big idea to really let sink in, it's this. A community's health is a super complex system. I mean, you've got factors like sanitation, access to good food, social conditions. All these things create a dynamic that you just can't see when you're only looking at one person at a time. It's like the saying goes, in public health, the whole is absolutely greater than the sum of its parts.
So, I want to leave you with this question. The next time you see a poster in a clinic about washing your hands, or you hear about a free health screening happening downtown, you'll know it's not just a random friendly suggestion, right? It's a tiny piece of a much bigger, carefully planned puzzle to keep not just you, but your entire community healthy. So, will you see that bigger picture now?